Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, May the 5th, 2021. Joining us today is Toronto Mayor John Tory, Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good afternoon, and thank you, Brad. Team Toronto has now distributed more than 1,246,129 first doses of COVID-19 vaccine. I want to thank everyone working across our city to get residents vaccinated. The city, Toronto Public Health, hospital partners, community health organizations, and community organizations generally are working across Toronto to get people vaccinated, and this is happening everywhere. But we do continue to focus on our hottest of hotspots based on scientific evidence founded on saving lives and stopping virus spread, and based on the effective use of limited supply. I do want to thank every eligible person who has stepped up to get vaccinated, those who helped people to step up, and of course those who have actually administered the vaccinations, and all of those who've supported all of our vaccination efforts. Our public health officials at the city have been clear that every single vaccine approved in Canada is safe and effective. And the best vaccine for you is the one that is available to you right now, the soonest. Today, the city and our partners are holding 34 clinics across the city, including pop-up and mobile clinics in hotspots and for people 18 plus, hotspots like North York, Toronto Health Partners with a pop-up clinic in Newtonbrook vaccinating 1,200 people, University Health Network holding 3 pop-up clinics in George Harvey Collegiate Institute, Habitant Arena, and Albion Arena to vaccinate more than 7,000 people. Unity Health Toronto, Downtown East Health Team, and West Toronto, Ontario Health Team holding 5 pop-up clinics to vaccinate 3,460 people. It's a great sign of progress that 223,817 people have registered for a vaccine in a city-run clinic since the eligibility opened up just this past Monday to people 18 and older who live in hotspots. 223,817 people just since Monday have signed up for a vaccine in a city-run clinic since we opened the eligibility up to people, the province did, 18 and older in hotspots. Chief Pegg will detail how available appointments in city-run clinics, which are entirely based on vaccine supply from the other governments, how those appointments are filling up. Every appointment we offer is based on the quantity of vaccine we are scheduled to receive, and that is to avoid having to cancel appointments. Almost every appointment has been booked over the coming weeks. We know we will see another increase in demand tomorrow when the province implements their decision to open up registration in the provincial system to all residents 50 and older, as well as the first wave of essential workers who can't work from home. In anticipation of new demand based on this provincial decision to expand eligibility, the city will be making available an additional 60,000 appointments tomorrow. These will be appointments between June 7th and 13th based on anticipated vaccine supply. Those appointments can be accessed by going to toronto.ca/COVID-19 and clicking the blue button that says Book a Vaccine. Appointments at hospital clinics can also be booked by visiting vaccineto.ca. We are working to get every shot of vaccine we receive into an arm as quickly as possible. And it's good to know that hundreds of thousands of Toronto residents want to get vaccinated and that more doses are on the way. But we continue to need more vaccine, and we've made that clear to the other governments who provide the vaccine as they receive it from the manufacturers. All governments and communities beyond the City of Toronto want more vaccine supply, need more vaccine supply right now, particularly in light of increased eligibility made available to more people. And I know that they are all committed to getting doses delivered as quickly as possible with whatever supply is available, and that particularly includes the City of Toronto. We have explained clearly in past instances, including with you at these media avails, that we have considerable additional capacity to allow us to do more in our city-operated clinics if we had further increased supply of vaccine. The more vaccine doses we receive and the more predictable these shipments become, the more we can maximize our Team Toronto capacity, which is considerable, to get people vaccinated in the hottest hotspots and right across the city. We know that the sooner we are all vaccinated, the sooner this pandemic will be over. And I know that's what we all want and what we're all working towards, and that will happen as quickly as we can possibly make it happen, but it is dependent on these things we've talked about today and which will be talked about further by Chief Pegg. And that includes working with the other governments and with other municipalities to find more ways in which we can address supply and other issues together. And I should add that we have been working very well together, all three governments, but we need to work particularly hard on the supply issue going forward to make sure that we can use that capacity we have to get more people vaccinated more quickly, especially those in hotspot areas. We are also working to make sure that people have safe ways to get outside for fresh air and exercise. I'm confirming today that active TO road closures along Bayview Avenue and Lakeshore Boulevard East will be back again this coming weekend, starting at 6 a.m. on Saturday, May the 8th, until 9 p.m. on Sunday, May the 9th. The roads through High Park will also be closed to vehicle traffic this weekend as a part of active TO. We had a good turnout for our first weekend of 2021 last weekend. I grabbed a bike myself to check it out, and was great to see people outside sticking with members of their own household, it seemed, and enjoying the space for walking and running and cycling. City staff are working to have an active TO road closure on Lakeshore Boulevard West for next weekend, the weekend 1 week from this coming Saturday. More details on that will be released early next week, and city staff have assured me as recently as this morning that they will be working to learn from any issues that arise during that closure on account of some of the circumstances which have changed in the past few months. There are also, of course, parks and ravines and trails and green spaces around the city that are open and available every day for fresh air and exercise, so please get outside and enjoy them, but please also do so safely and within public health guidance. It's now time for Chief Pegg to provide a further update on the preparations for the vaccination registration that will open up tomorrow. Chief?
Thank you, Mayor Tory, and good afternoon. Before I begin my formal remarks this afternoon, I would like to acknowledge that this is Canadian Mental Health Week. This year's theme is Get Real About How You Feel. The impacts associated with COVID-19 have been and continue to be far-reaching. The additional stresses, fears, and pressures that are the result of the COVID-19 pandemic are, of course, in addition to those of everyday life. Over the course of COVID-19, there hasn't been a week where I have not had the opportunity to talk about those stresses and pressures with a number of people. Each of the feelings that we all experience, especially as we continue to move through COVID-19, are normal responses to abnormal events. It is okay not to be okay, and it is okay to get real about how we feel. There are important mental health resources available on toronto.ca/COVID-19, and I encourage you to take advantage of them without hesitation. Reaching out to seek professional help to both get healthy and stay healthy are signs of strength, and I encourage you to feel comfortable in doing so. Regular check-ins with a psychologist is an important part of my personal health strategy, and he plays an important role in helping me to remain strong, healthy, and resilient. Please take a few minutes to check in on your family, friends, and those around you, and let's do our part to get real about how we feel. The eligibility for booking vaccine appointments is determined by the province of Ontario. On Monday morning this week, the province extended vaccine eligibility to those who are 18 years of age and older who live in a COVID-19 hotspot community. Since Monday morning, 223,817 people have successfully booked their appointment to receive COVID-19 vaccine in city-operated clinics. First and foremost, I am very pleased to see such an overwhelming response to vaccine eligibility, and I thank everyone for making vaccination their priority. Of course, our ability to make vaccine appointments available and to administer vaccine in city-operated clinics is dependent upon the supply of vaccine that is made available to us. As of noon today, each of the city-operated clinics are either fully booked or very close to being fully booked on a daily basis between now and June the 6th. For the remainder of this week, our clinics are 99% booked. For the week of May 10th, our clinics are 93% booked. For the week of May 17th, our clinics are 97% booked. For the week of May 24th, our clinics are 95% booked. And for the week of May 31st, our clinics are 96% booked. Should the province of Ontario make additional vaccine available to us for any of those periods of time, we're able to open additional appointments to match. Beginning tomorrow morning at 8 a.m., the province of Ontario will again expand vaccine eligibility to include the following additional groups of people: anyone aged 50 years of age or older, individuals with high-risk health conditions as defined by the province, and essential workers who are unable to work from home and who are listed in the province's Group 1 listing. The specifics relating to these groups are available at toronto.ca/COVID-19. I'm pleased to advise that as of tomorrow morning, an additional 60,000 vaccine appointments will be made available for booking in city-operated vaccine clinics via the provincial booking system from June 7th to 13th. We are opening this block of appointments on a proactive basis in an effort to ensure that people have as much opportunity as possible to book their vaccine appointment. Over the course of this week, we were able to vaccinate 80,214 people across our network of 9 city-operated clinics. The number of appointments that are made available corresponds directly with the number of doses of vaccine that are available to be administered. As additional vaccine is provided to the city by the province of Ontario, we are both able and ready to expand our clinic operations to match. I remind everyone that in addition to the vaccine opportunities in city-operated clinics, our hospital and Ontario Health Team partners are also administering vaccines each day. Please go to vaccineto.ca for opportunities that may exist across their network of clinics. I also encourage those active on Twitter to follow Vaccine Hunters Canada for additional opportunities and information about vaccine outside of the city-operated clinics. Our vaccine clinic planning includes the requirement to deliver the second doses of vaccine that are scheduled. We will begin to administer scheduled second doses of vaccine on the week of July 7th and weekly thereafter. Thank you for all that you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. It's now my pleasure to ask Dr. de Villa to bring her remarks.
Thank you, Chief Pegg, and good afternoon. Today, I'm reporting 991 new cases of COVID-19. 1,162 people are currently in hospital, and 281 people are in intensive care. I'm also saddened to report 9 new deaths today. I want to speak to the AstraZeneca Oxford vaccine today and the risk of blood clots because I know there's a lot of talk about both this week. At this point in time, we are waiting for clarification on when further AstraZeneca deliveries for Toronto will resume and on what scale. Nonetheless, it is reasonable to expect this will happen and that many people will have the option of accepting their first or second dose. If you are one of them, the likelihood of a serious blood clot occurring is currently accepted as 1 in 100,000. Some set the figure at 1 in 250,000. I would suggest we can, in fact, look to the United Kingdom for confidence in the low risk of receiving the vaccine. More than 22 million first doses of AstraZeneca have been given there. And thus far, there have been 209 cases of blood clots related to the vaccine. This equates to 9.3 cases per 1 million doses. In Canada, more than 1.7 million doses have been delivered here, and the risk of blood clot-related side effects continues to be considered very rare. We are dealing with a new virus. As such, we are all in unexplored territory, and our knowledge related to the virus continues to grow. There is a huge drive in medical and scientific communities to produce further understanding of the virus and the vaccines. We now have more than a year of evidence to show what COVID-19 can do. What we know today is that the vaccines work. We know that they are our very best protection against COVID-19. We know that in Toronto right now, there are about 260 cases of COVID per week per 100,000 people. Many physicians have said, and I agree, that the odds of getting COVID-19 without the protection of a vaccination are far, far greater than the risk of a serious complication as a result of being vaccinated. I think the facts bear this out. But we all have to decide for ourselves what we think is right for us. If you have doubts or concerns, please seek out reliable advice from credible sources. In my view, your best protection is a vaccination because COVID-19 isn't going away anytime soon. The case count figures over the last few days suggest a stabilization, although at a level that remains high and continues to cause severe illness and death. While any improvement is welcome news, we have to greet this improvement with caution. I liken it to a patient being recategorized from critical to serious condition. It's a better condition, but it's still a long way from best. And that is where we are, as very early signs of improvement seem to be emerging. With that, I'll now hand it over to Brad to moderate the questions.
Thank you, Dr. de Villa. Before we go to questions, just a reminder to please unmute yourself so we can hear your question, and we'll go first to Matt Bingley from Global News. Matt, go ahead, please.
Hi to Chief Pegg. It sounds like the rate that you're going through vaccines with the new cohorts is concerning by the supply that you actually have. Outside of the 60,000 new slots, how many, I know you went through the percentages, but how many in a number value appointments do you currently have between May and June?
Hi, Matt. I don't actually have that with me, but I can say when we're looking at, when we're in the 98, 99, 100% range, we're talking about literally some very small numbers of appointments. I would enumerate them in the range of tens of appointments. I will say this, though, and important to note, we're seeing a considerable amount of variability and movement in the system, and that indicates that people are canceling, they're moving, they're changing their appointments. So I do encourage people that are eligible to continue to keep a close eye and continue to do their very best to book their appointment. We are, along with Dr. de Villa and the Toronto Public Health team, we are in daily conversation and direct connection with our provincial counterparts with respect to the supply of vaccine. We have capacity in our clinics, as do our hospital and OHT partners. So the very moment that additional vaccine can be made available, we are ready to expand clinic operations and open additional appointments. And I certainly look forward to the point at where we can do that.
And to you as well as Mayor Tory, I'm just wondering, has the province given you any indication that it will increase the supply to match the eligibility tomorrow? And I'm wondering, when you have the possibility of people logging on in the days to come to find no appointments available, many of them essential workers who can't work from home, I'm wondering how worried you are that the risk for them is being prolonged, as well as the ability for the city to open back up.
Well, I'm happy to start. So we, as you know, Matt, as we've said, we open, the appointments that are open in the city-operated clinics are directly correlated to the vaccine that is allocated to the city in order to administer. So I can assure you that every single dose of vaccine that is allocated to the City of Toronto, including those doses that are being allocated to city-operated clinics and those that are administered by our partners, every single dose is being allocated and administered. So Dr. de Villa may be better suited to speak about the provincial vaccine allocation, and I will step aside and ask her to say that.
Hey, Matt, I would just add to Chief Pegg's comments by stating this. You were talking specifically around essential workers, and you'll recall that we actually have a sprint strategy, a very focused strategy that looks at certain hotspot neighborhoods here in the City of Toronto. And together with our vaccine partners all around the city, we're focusing our vaccination efforts in those communities. So by doing that, one, we have achieved really remarkable uptake on vaccine in these neighborhoods, and two, because there are so many essential workers in our community that live in these neighborhoods, we are actually very successfully getting to essential workers and their households by using this strategy. I think the final point I would make is that we've just heard today, I understand our provincial counterparts just announced the beginning of a workplace-related vaccination campaign. Toronto is part of that, and we're certainly looking forward to participating in those efforts. But of course, any new supply that comes for vaccine, we are more than happy, along with our vaccination partners, to take part in, and we will do our very, very best, as we have throughout, to make sure that those doses get into arms as quickly as possible.
Okay, thank you. We'll go next to John Woodward from CTV News. John?
Hi there. This is for the medical officer of health, Dr. de Villa. There are several religious schools that Toronto Public Health has been investigating for seeming to have classes despite school closure orders, and they may have religious exemptions, but some of these schools were highlighted as far back as January. I wanted to know what's going on with these schools and the investigation into them, and why is that investigation seeming to take so long?
So thanks for the question, and you're quite right. There are some investigations that are happening right now, courtesy of the team at Toronto Public Health. These are complex situations, as you can well understand. With many of these investigations, one does need to look into the specifics of what's happening within the context of the school or the facility, understand whether there are applicable exemptions, and then make appropriate determinations. This is not lost on us. We are absolutely working on this amongst many other aspects of the COVID-19 response. And certainly, if there are actions that we can take and should take in the interest of public health that are in keeping with our authorities, you can rest assured that we will take those up.
All right, and then my second question, I think, is for the mayor. These outdoor restrictions that the province has implemented, and by that I mean the basketball and golf and frisbee golf and so on, they were panned by scientists as being counterproductive, that might get people back inside, which is more dangerous. But it's up to Toronto to enforce them, and that costs money. And I thought I would ask you whether, do you think Toronto should bear the cost of enforcing these rules, or should the province somehow foot the bill for it?
Well, it really isn't a matter of money. It's a matter of priorities. If we had all the money in the world, then it would get us a lot more people. But we have a certain number of people available to do enforcement. They've made it very clear at all levels, the police and the bylaw enforcement people, that they're focusing on large gatherings in places like that where it is more likely to pose a threat to public health and to encourage the spread of the virus than in some of the other instances that you cited. And so, and we're very focused on that and focused on vaccination as opposed to any change that I'm sure is being continuously re-examined with respect to how outdoor spaces are being used or not used.
Thank you. We'll go next to Francine Copen from the Toronto Star. Just have to unmute yourself there, Francine. Okay, we'll come back to you, Francine. Maybe you're just having some technical difficulties. We'll go next to Mark McAllister from City News. Mark?
Thank you, Brad. A question for perhaps Chief Pegg as well as Dr. de Villa. We've been speaking with the daughter of an 86-year-old woman who is homebound on a waiting list since she was first eligible for the vaccine. Among those who were considered first priority based on her age, she was originally told EMS would come to administer the vaccine. That didn't happen. Now she's continually calling and being told that she's not considered high risk or living in a hot spot, so she can't get the vaccine at this point. Why is this woman and others like her at home not getting their shot at this point?
Well, perhaps I'll start and then Dr. de Villa can add. There is a homebound vaccination program that has been in operation for some time and has been delivering a considerable number of vaccines over since its inception. It is the collection, the way the process works is independent primary health care physicians, family doctors and the like, place eligible homebound residents on the list. That list is subsequently compiled and then grouped geographically. The reason that it is grouped geographically for mobile response is primarily as a result of the restrictions, the physical restrictions around the vaccines. At the point when, again, Dr. de Villa is better suited, but at the point where a vial is punctured by a syringe, there is a defined period of time for which the vaccines contained in that vial must be administered. So just from a practical logistics standpoint, those eligible homebound residents are compiled into groupings. They are prioritized based on high risk and high risk communities and such, and then of course mobile homebound teams are deployed. It is a considerable work that has been undertaken. It is work that is priority for us, that is continuing, and as our mobile opportunities expand, so will those opportunities. Perhaps Dr. de Villa would like to add.
So, Mark, I think the chief has covered the main points quite nicely. I would say this, that I know it's difficult, and I'm sure it's frustrating for this individual to wait. But as the chief pointed out, there are some logistics considerations, and the intent is to get to everybody in as timely a fashion as is possible, recognizing that there are some logistics issues involved that may make some people unfortunately have to wait a little bit longer. But certainly there are many, many people working on this, seeking to ensure that those who are eligible for the homebound program are getting access to this life-saving vaccine in the timeliest fashion possible.
I know that for the general population, there has been a shift, obviously, to the hotspot areas, but it seemingly has left people like this behind when they've been waiting for more than a month to get their shot. How is it that the most vulnerable people in these circumstances have been left behind?
Mark, I would say this. I don't think there's any shortage of people who might be described as vulnerable. And I would also add that our primary focus, and this is not just Toronto Public Health or the City of Toronto, I would say that this is for all the vaccination partners. As soon as we get supply available to us, we are doing our level best to ensure that those who are eligible to receive vaccine are getting it in the timeliest fashion possible. I can equally say that there have been many who have. The chief spoke to this, that there have been a number of people served through the homebound program successfully, and we certainly look forward as the vaccination partners across the city to serve all those who are eligible in the homebound program, and of course all those who are eligible through the many other channels through which vaccine is available. We would like to see as many vaccines as possible in as many arms as possible in as efficient and effective a manner as we can carry out.
Okay, thank you. We'll come back now to Francine Copeland from the Toronto Star. You there, Francine? Francine, are you there? Okay, seem to be having some technical difficulties. We will come back to you again, Francine, I promise. We'll go next to your colleague, David Ryder from the Toronto Star. Dave, go ahead. David Ryder from the Toronto Star. Screen showing you are muted. Okay. All right, we'll come back to you as well, David. Let's try Natalie Johnson at CTV. Oh, sorry. Go ahead, Dave. All right, there you go. Go ahead.
Okay, yeah, sorry, everything was hung up there.
Okay.
My question is for Mayor Tory and for Chief Pegg, and it's about the TDSB lawsuit that was filed earlier today. It makes serious allegations about the conduct of Toronto Fire Service and also Chief Pegg himself. I know you put out sort of a general statement saying you're not saying anything, but I want to give you the opportunity to address it and just say if anything you want about confidence in the system or the service or the chief.
I have confidence in all elements of the system, but there are times when even in the same broader public service family, there are going to be differences of opinion as to things that took place. And that's why we have lawyers and courts, and this is off to the courts for their review and disposition, and we will watch that process unfold and see what is determined there, which I think is the best place for these things to get resolved.
Chief Pegg, do you have anything to say?
Sure. Hi, David. Not a lot I can say over and above what the mayor said. I became aware of the statement of claim being filed today. It was actually sent to me by a colleague, or a copy of the media, one of the media articles was sent to me by a colleague. It is now in the hands of City Legal, as is our process at any point in time for any legal action. And that's where it's best suited. It is a matter that will be managed by legal services and ultimately in the courts, and I'll certainly leave it to my colleagues in legal services to manage that appropriately.
Okay, I don't have another question. Thank you both.
Thank you. We will try 3 times lucky, we hope, with Francine Copen from the Star. Francine, you there? No. Okay. We'll come back to you again. Natalie Johnson from CTV News. Go ahead.
Hi, everyone. Dr. de Villa touched on this quickly, but can you elaborate on how the workplace vaccine campaigns will work in Toronto, where and when we might be seeing them? I know the last time that we spoke about this, you had said that there wasn't enough supply to start bringing the vaccines directly to the...
So Natalie, this is the workplace vaccination undertaking was just announced by the province maybe not even a few hours ago. So I certainly am interested in hearing the details of how they foresee this unfolding, and am looking forward to the results of the campaign. As I've mentioned earlier, there's nothing more that any of us in public health wants than to see vaccines in arms as efficiently and effectively as possible so that we can put this pandemic behind us. And we're certainly eager to participate with our provincial counterparts on this endeavor. No details at this point really to provide, but we'll look forward to hearing about them and then speaking about them once we have more.
You just have to unmute yourself, Natalie, for a follow-up. Sorry, folks seem to be having... Oh, there you go, Natalie. Go ahead.
Hi, sorry, guys. WebEx keeps freezing.
Yeah, we're having some trouble today. Apologies. Natalie, you there? We see you're unmuted. Having some technical challenges today, obviously. We apologize, everybody. We'll come back to your follow-up, Natalie. Let's go next to Samantha Beattie from CBC News. Samantha, are you there? Again, just a reminder to please unmute yourselves. Just give us a few seconds here, folks. We'll see if we can get this sorted out. Just stand by, folks, please. Sorry about that. Natalie, are you there? No. Let's try Jane Stevenson from the Toronto Sun. Jane? Okay, what I'm going to suggest we do is...
Hi, can you hear me now?
Yes, Natalie, okay, thank you. Go ahead.
Sorry, guys.
With your follow-up.
It keeps freezing. I'm not sure if you heard my second question.
We did not, so if you could repeat it, please.
Okay. Well, you had
Hi, Brad. The suggest we do is
You had mentioned that the next block of appointments opening up is for June 7th to 13th. As the eligibility continues to expand in the coming weeks, 2 new groups, will the appointment dates continue to be further back into June or even say July, or will more dates potentially be added earlier in the calendar as more supply comes in?
So why don't I start answering the question? We'll see whether the chief feels I've answered it sufficiently. So at this point, what we have done through the city's clinics is to make appointment blocks available as we become more and more aware of specific supply of vaccine coming on board. And you mentioned that there are increasing eligibility requirements, or eligibility categories, I should say, emerging. We've got a new block opening up tomorrow in concert with the expanded eligibility as announced by the province, and more in weeks to come. So as those eligibility blocks or categories expand, and as we hear more about vaccine supply, we are then opening up more and more availability for appointment bookings as all that information comes in. Anything further to add, Chief?
Okay, thank you. We're going to try Francine Copen again from the Star. Francine, are you there? We can see you're unmuted, Francine.
Can you hear me?
Yes.
Can you hear me?
Yes.
Okay, finally. I'm really
Thank
sorry
you.
about that. So
Go
my
ahead.
question is, can you hear me still? Okay. My question is about students. Understanding that it's, of course, the province who determines who gets the vaccine and in what order. Given the way things have been going, what is the likelihood that Toronto students who are eligible will be able to be vaccinated before they return to school in the fall? And I guess that question is for Dr. de Villa and Matthew Pegg.
So Francine, I'm glad we were able to resolve the technical difficulties and have you join us. With respect to the students, I think there is still much that has yet to be fully understood. We just got the notification that Health Canada has approved the use of the Pfizer vaccine in youth aged 12 years to 15 years, which is great news. And I know for a fact that there have been a number of tables and discussions at the provincial level where the subject of youth vaccination has been discussed and is still being discussed. So it's my understanding that we should be hearing shortly, now that we have this announcement from Health Canada and this approval that has been provided by Health Canada. We should be hearing from our provincial counterparts soon what the details of the administration of vaccine will look like for Ontario youth. And we are certainly eager to participate in that vaccination campaign once we have some details. And we'll be sure to let you know about those as those details become clear to us.
We'll try a follow-up, Francine, while we still have you.
Yeah, my follow-up question is for Chief Matthew Pegg. You mentioned that the city clinics are fully booked into June, almost fully booked until June 7th, I think you said. What does that mean for the people who become eligible tomorrow, the new groups who become eligible tomorrow to book vaccines? I mean, will they be booking, do you have supply for them? What's going to happen?
Hi, Francine. So that is precisely the reason why we have worked proactively to open another block of appointments at the 60,000 appointment mark. That block of appointments will be opened in the system to coincide with the eligibility change tomorrow morning, thereby providing as much additional capacity in the system as we're able to provide. Obviously, as we've said throughout, we are limited by vaccine availability. So we are making every single appointment available that we can in accordance with the vaccine that's being provided. If, as time moves on, as we, days and turns into weeks, as we move further down the calendar, if additional vaccine ends up being made available to us in the City of Toronto, we are immediately ready to expand our clinic operations as our hospital and OHT partners. But at this point in time, from a city-operated clinic perspective, you can expect to see additional capacity open tomorrow. And I think it's important to remind everyone that there is also capacity in hospital-operated clinics and Ontario Health Team-operated clinics, hence why in my remarks today I encourage people not only to of course go to toronto.ca/COVID-19, but also to vaccineto.ca, which is our hospital and partner operated site for their clinics, and of course the good work that Vaccine Hunters Canada is doing on Twitter. So I realize that that's a lot of clicking and a lot of looking, but we're simply doing the very best we can do with the circumstances that present themselves, and I appreciate everyone's patience and understanding as we move through the process.
Great, thank you very much, and thank you, Francine, for your patience. We'll go next to Samantha Beatty from CBC News.
Hi, this question is for Chief Pegg. You kind of touched on it before, but I just wanted to ask again. So with a large vaccine supply expected to come in this month, but city clinic appointments booked mostly, is there anything else that could be done on the city side to increase the number of doses given out per day across all clinics? Or does it simply just come down to supply at this point?
Hi, good afternoon. It is simply supply. We are opening every single appointment that is available on a one-to-one basis with the amount of vaccine we have to administer. So there really is no other secret formula other than the more vaccine that can be made available, and in the event and in the time when more vaccine is made available, we have capacity in our clinic system to do more every day and every week. And at the moment where there's more vaccine, we absolutely will.
Thanks, that's it for me.
Okay, thank you. That actually concludes the questions. Again, my apologies to everybody for the technical glitches this afternoon. We do appreciate your patience. Please stay safe and stay well, and our next scheduled briefing will be this Monday, May the 8th, I believe it is. Stay well. Thank you.